have a very ambitious program. So far, we are able to deliver it twice a week, Sunday and Thursday. And we have our curriculum is completely full, really full. Okay, I will share some screen with you. That one here. Okay, Dr. Islam Ramadan is our colleague, and he is in Ireland. And I will do something now. Okay, Dr. Islam, just give me 1 second. Okay. Okay. Dr. Islam Ramadan is going to be one of our lecturers here in the near future. Okay. So I will share the screen with you here. That is our timetable. And where we are now, we are in session 17. Okay. That is tonight here. So do you see that? Yes or no? Do you see the timetable? Hello? Hello? No. Okay, no answer. That is the awake craniotomy tonight and the drug management of the chronic neuropathic pain. Drug management of the chronic neuropathic pain. Dr. Ahmed Kafafi is tonight. He is not going to talk about neuropathic pain in general, but just only drug management, pharmacological management of neuropathic pain. Next Sunday is going to be actually, Prof, good evening to you. Prof. Saad Mahdy is joining us, and he is the main speaker tonight with Dr. Kafafi. You are very welcome, Prof. You need to unmute. Good evening to you.
Good evening.
How are you?
Oh, alhamdulillah.
Good, good. I'm trying to explore the timetable with our colleagues now, just to show them our plan for the next, just to make them a little bit attractive to them to show them the next few sessions.
Sure.
So that is the next Sunday, 28th of June, role of critical care ultrasound by one of the most expert ultrasound intensivists, Dr. Walid Shib. And we have the usual lecture of Prof. Samir Ansari. And we have, as I told you yesterday, about the bradycardia series or arrhythmia series with Dr. Adil Hussein. He's specialized in ICU, especially in cardiovascular resuscitation, arrhythmia, and all stuff. As you see here, next Sunday as well is Dr. Kafafi again. And Dr. Islam Ramadan, he is joining us tonight, and he's going to talk about the airway management. A very good lecture because he is a fellow in Beaumont Hospital for airway fellow. So it's very, very specialized job about airway management. I believe if I am going to talk about who's going to the best to be talking about the airway problem and the airway management, so it is Islam Ramadan. That's our moderator, Dr. Amr Salam. He's appearing on the screen now. Good evening, Dr. Amr.
Good evening, Dr. Saad. How are you doing?
How are you? We are joined by Professor Saad Mahdy, and he's here at the moment. And
Good evening, Dr. Amr.
Good evening, Dr. Assam. That's a great honor.
Very nice. Wallahi, to see you today.
Alhamdulillah. Alhamdulillah. Dr. Amr is one of the Egyptian doctors in Ireland. And actually, Prof. Assam, we have a very good bunch of people here. Wherever they go, they take all the jobs. And actually, in Beaumont Hospital, there were around 6 high training jobs, and around 20 people applied, shortlisted 12, and all the 6 people were Egyptian. So
let us say it is Egyptian gang.
Yeah. So it's really so proud to be working and seeing all your colleagues getting all the stuff here. We have just on 16th of July, we have one of the Iranian expert in pain medicine, and her name is Helen Gayari, and mostly you know her, everybody, and she's going to talk to you about clinical points in post-thoracotomy pain syndrome. Our
Just,
curriculum is
just one note,
huge.
Dr. Saad. Just one note. I
Okay.
want to just to say something about this Iranian
Yes,
guy.
you know her.
It's very nice. No, I don't know. But it is very nice to supply our Mega Online course with different
Exactly.
nationalities and to get benefit from this exposure for the different experience for people. And this very nice step. You are doing a great job.
Thank you very much, Prof. You know, and actually, one more thing, Dr. Amr Hashim, he is from Alexandria. He's working in UK now. Dr. Amr Farghali, he is in Ireland at the moment. Dr. Prof. Dominic Harmon, he is a professor of pain medicine, and I'm working with him because he's senior to me, and he's the lead person of the pain medicine in my university. So Prof. Dominic Harmon is going to give a good lecture. It is a philosophy of pain or something like that. It's not a real pain medicine, but it's far behind that. So perceived and injustice and the chronic pain. It is going to be in 6th of August. Another one, she is Dr. Emer Curran. She's my colleague as well from Galway. Most probably Dr. Amr Salam knows her very well. And she's going to talk to us about brain stem death and organ donation. Emer Curran is one of the leads in organ donation and organ transplant in Ireland, and she is really very good lecturer in that situation. Another guy from Ireland, he's working with me at the moment, and he's a consultant anesthetist. He's going to talk about burn. So that day, 13th of August, is going to be totally Irish day. Just I would like to say that another guy here who's going to talk about preeclampsia. His name is Jim Shannon. He's the lead of obstetric anesthesia in my university, and he's really very good guy about preeclampsia. One more thing to talk about. Yes, this guy actually he saw our advertisement, Prof, on the internet, on the LinkedIn, and he contacted me. He's going to talk about spinal cord stimulation and the neuromodulation. He works in UK. He's originally from Italy, but he works in UK. As you mentioned, Prof, that he is a case mix, and all of this, you know, is very good. So that is our current program. So it is just, if I take another only 2 minutes to show my colleagues that what we are aiming to do from the next after this program. We're going, Prof, to talk about we will make it days, you know, rather than mixed lecture. Like this one here, pediatric in one day, then cardiovascular physiology, cardiovascular pharmacology, and another cardiovascular topic. Cardiovascular. So whenever you come to this webinar, you will learn a lot about one topic. Ultrasound, echo. So management of failed epidural, obstetric, something like that. Labor pain as well, and it's very good. So our program is going not to finish soon, so but it's going to be a little bit modulated, you know. So I will stop here, Prof, and Dr. Yasser Zaghloul, he is here. He's coming very soon. Just wanted to come and say hello and greeting you, Prof, and all our colleagues.
Dr. Yasser, I saw him in Emirates, Dubai. I don't know if he remembered me or not. He, يعني, ما شاء الله, very excellent.
Dr. Yasser Zaghloul, I'm so proud that he's from Alexandria as well, and he is my senior colleague. And actually, when I started my residency in Alexandria, I was just starting to sign my paper, and Dr. Yasser Zaghloul was signing off his paper in the same office.
All the people from Alexandria, no people from Upper Egypt. What is this?
Well, it is my honor to know you, Dr. Assam. I saw you many times also in the conference, and I see your interest in neuroanesthesia, like myself as well. Just I was talking with, I will talk in English because I saw many of the attendants are non-Arabic. So all the talk will be English. Anyway, because we have now a lot of attendance and more responsibility after recognition and the accreditation of the course by the Egyptian Society of the Anesthesiologists. this talk is for the speakers or myself as well. Now we need to have good objectives and a good message for the persons who are listening for our lectures. We should have clear message in each lecture. What is the objectives of the lectures? What is the teaching purpose of this lecture? The other point also, we need to be most of the lectures be updated, and it is useful for teaching. If the attendant going for the Egyptian fellowship exam, you should have some basics to help them in the exam as well. The other issue, we need our information in the slides very clear, very short, and as we can, according to the international guidelines, which is accepted. For example, you are talking now about awake craniotomy or patient with traumatic brain injury or we have international guidelines for the traumatic brain injury, for example, patient with sepsis with septic shock, patient with severe asthma, patient with status epilepticus. All these problems have international good guidelines written well for the clinical practice. So this message for myself and for the speakers, try to be very simple, very clear message, and we should respect the opinion of our participant. What do you think, Dr. Sam?
I agree totally with you, and I'd like to add something about the presentation. I'd like, since long time, to share the junior staff for the presentation and for the attending for the conference. This is my dream. This is my dream to encourage my juniors to attend the conference and present. And one of my dream is to make in the Upper Egypt one conference, 1 day or 2 days only for the juniors. This encourages the juniors to introduce their knowledge, and if they are wrong, even when they are speaking, all of us, we are learning. We are learning from each others, and we should encourage the next generation, because I don't like to introduce my lecture in every conference with the same subject, with the same topic, with the same experience. We need to listen from the junior as well as the senior, of course. We need the experience, like the football team. The football team, they have the seniors, and most of the football teams, they are juniors.
Correct.
I don't know if I'm correct or not.
After listening for your lecture or for any speaker, and they are going second day for the hospital, they use this information to improve the patient care.
Yeah.
This is
but
my
we
aim.
should encourage them to introduce themselves. This is
correct.
I like this. I like this. And the way we are behind them, we to be linked to us, we can help them in preparation of the presentation, guiding them for the talk, and to give them the chance to introduce themselves for the audience in different conferences or in different meetings.
Dr. Amr Salim, any comment?
Of course, I cannot add any more. In fairness, what you were talking is like, that's what we discussed with Dr. Saad yesterday as well. So the advantage of this mega course is, one of that is like, we are getting experienced people from every specialty, from every training aspect, with different aspects for everything, different ways for presentation, the cases with different presentations as well. It's a brilliant way, and the whole different aspects will gather together and give an experience, either in the medicine from most of experienced people in that team, and the other side is the way to present itself.
So hopefully, inshallah, by the end of our lectures, we have some change in the clinical practice, or improving the clinical practice of our participant, inshallah. Saad, Saad.
We have a survey at the end, and I would like to encourage all attendees to fill the survey, just to let us to improve the way you conduct the webinar. And one of the criticism of our survey is the advertisement of the webinar. And I told them, well, I offered one of the model 4 millions, and she insisted for 5 millions. So I couldn't pay her to advertise for the webinar. So, so we're doing our best, you know. One of the most important, Dr. Yasser, is Dr. Ines Kamel. She's the director of the Egyptian Fellowship Program, and she insisted for the report for the candidates of the fellowship candidates, you know, because she completely recognized this program as an alternative teaching material to the Egyptian Fellowship. Prof, are you okay with your slide and everything?
Yeah. I'm ready.
Okay, that's fine.
Yeah. Sorry, Dr. Saad, and just a question. So the attendees cannot hear what we are telling now, or they can?
What did you say again?
Can they hear what we are talking about it now?
I believe they are, because I did the test with them and they were listening to us, and they mentioned that they are able to hear
Just
us.
to ask them to, if they are able to ask any question, just write it in the text as a text, or we can.
You see, there is here a chat, and there is here question and answer.
Yes.
They will write on both things if they have any comment, and you kindly can collect those stuff, and you will do the lecture, the question after the lecture finish, please.
Perfect. Yes. Hope there is no problem with the connection with everyone, and everyone.
Well, once again, the internet, as anything, and we are talking about the air, you know, sometimes the internet working very well 24 hours, and during the webinar might be interrupting with anyone, a speaker or from the host here. So if anything wrong happen, we'll connect immediately after that. So don't leave, please.
Yeah, perfect.
When will be the course for the EDIC Part 2 exam? Well, we'll do our best to get the material and get ready for the Zoom for the EDIC. We'll do our best. I found today, just the afternoon, I found a colleague from Indonesia just asking for the link and to join the webinar. I was so happy, you know.
Yeah, it's very good to have like different countries with different experiences, and just give us a feedback about this course, how it runs, and that will give us a chance to improve ourselves and improve our presentation.
Exactly.
And improve every aspect of this course, and that will make it better for you. Yeah.
That's correct. Thank you. Dr. Amr, before starting, we will be sure that we can stream on the Facebook. So before you introduce Prof. Sam, I would like to be sure that I am able to stream on the Facebook, because maybe this time and next time, just that only time to go on Facebook. Otherwise, we will have our website, and we will go on our website rather than the Facebook.
Okay, perfect.
Assalamu alaikum, Dr. Saad.
Alaikum salam, Dr. Walid. Dr. Walid Aswa is our co-founder of the course, and he's an excellent colleague, and he's another anesthetist, and he's welcome you.
Welcome all.
Thank you, Dr. So we have Prof. Assam, Dr. Yasser here, Dr. Amr Salam.
Walid, how are you doing?
Fine, sir. I'm fine. ازيك يا باشا؟
Alhamdulillah. Everything
دكتور
is okay.
عصام. Everything is fine. الحمد لله دكتور عصام.
Alhamdulillah.
الحمد لله. Miss you bro. Miss you والله.
Dr. Assam is one of the great people supporting us emotionally and scientifically, and he's really standing very hard with us, supporting us very well. And it is a good chance. I won't be able to thank him enough.
Dr. Saad, you are a great person.
Thank
Really.
you. Thank you.
Everybody I am speaking with him about you,
Thank
they
you.
acknowledge you, they appreciating your effort. You are very
Thank you.
nice. You are dealing with the people very kindly, and you
Thank
are
you.
scientifically, no doubt of this.
Thank you.
So
very
we
much.
are proud that you are the leader of this
Thank you.
committee. Really,
Thank you.
really. And without your
Sure.
effort and the organizing committee, no achievement will come to this mega online course.
Thank
So
you very much.
thank you for you
Thank
and
you.
for the organizing committee.
Thank you.
Thank you. I want to say good evening to Dr. Yasser Zaghloul and to Dr. Amr Salam.
Good evening, Dr. Walid. How are you doing, sir?
Fine. How are you, Dr. Amr?
Thank you. Fine,
Also, Dr. Islam Ramadan. Dr. Islam
Dr.
Ramadan and
Islam
Dr.
will have
Ilyas
a
Farouk.
very good lecture in the next few days,
Inshallah. Inshallah. It's scheduled
Inshallah.
already. Scheduled already. ازيك يا دكتور ياسر؟
اهلا
منور.
ازيك يا وليد how are you
I'm fine. الحمد لله. Fine. الحمد لله. Fine.
الحمد لله رب العالمين الحمد لله. هنسمع صوتك امتى في المحاضرات؟
قريب ان شاء الله. بروفيسور سعد بس يبرميت مي والكوميتي يوافق على محاضراتي وبعدين
باشا الويبينار كله تحت امرك يا دكتور وليد.
العفو يا فندم. العفو يا فندم.
مهتم بالتنظيم اكتر انت.
ديفينتلي انا محروم اصلا من ان انا اسمع المحاضرات بانصات نتيجه ان احنا بنبقى بره بنراقب وبنرتب. يعني انا كلها بسمعها مسجله.
good organization yeah.
ثانك يو. انا لو على العموم بسمعهم مسجلين يا دكتور ياسر. بسمعهم مسجلين.
ان شاء الله خير دايما باذن الله.
ان شاء الله دايما ان شاء الله. ثانك يو.
تبدا سعد ولا لسه شويه؟
Just to give us 2 seconds.
8 minutes.
We are 8 minutes behind now, so
Yeah.
just another 3 or 4 minutes, and we'll go live.
Inshallah.
Okay.
Because at 7 o'clock or 8 o'clock Cairo time, the people is starting to come numerously in the webinar. We don't want to miss them.
Yeah.
هو حقيقي الفيرتشوال teaching ده يعني it is a great revolution of the teaching itself. Everybody can deliver the lecture from his home at his comfort and his minute, whatever time he likes, you know, and even the same time is the recipient as well, the candidate attendee, they are sitting at their home or their office, their clinic, and it's a fantastic opportunity, to be honest.
Yeah, sure.
And the saving traveling, you know, is huge advantage, to be honest, now at this time.
No, traveling is better than now.
We all hope to travel, to fly again. Yes. Yes. Inshallah, first flight will be to Mecca. We have this promise. First flight will be to Mecca.
Inshallah.